By the way, in staying with updates from the US, I must also inform you that the Trump administration fired staff at the Centers for Disease Control and Prevention and at the Food and Drug Administration as it embarked on its plan to cut 10,000 jobs at the Department of Health and Human Services. Now, these cuts are said to be part of a wide plan by Donald Trump and billionaire ally Elon Musk to shrink staffing levels in federal departments as well as agencies. Health Secretary Robert F. Kennedy Jr. has described the cuts at the CDC and the FDA as essential to streamlining a bloated bureaucracy. However, the cuts, including earlier dismissals, have led to the departures of top scientists at key agencies for public health, cancer research and drug oversight, raising concerns about how the US will safely oversee the health sector and also respond to emergencies. But for further clarity, we have with us at the moment Jake Novak joining us. Jake, thanks so much as always for making time for us. Robert F. Kennedy Jr. has clearly called this a revolution, but many experts are warning that while they are in support of improving the FDA, their efficiency to deliver more affordable medicines, many of these reported cuts appear to do just the opposite, right?
Well, a lot of those experts don't have the exact numbers. Nobody has the exact numbers yet from every single name and every single division of the health department where people are being laid off. Now,
Right.
The Trump administration and its supporters are saying that the bulk of the people being laid off are in administrative positions, human resources. They are not the scientists. They are not the crucial inspectors. They are not the major health officials that really will have any effect on the public health in the United States. But even if some of them are, and clearly some of those people who got laid off will be those people, it could be a very small number, but there will be some. You have to understand that there's a very strong percentage of American voters who feel that the way that the health department in this country handled the COVID outbreak and the COVID lockdowns was so negligent, was so much failed the American people, and also with the way that they forced the vaccine on the entire population, that they are saying good riddance to some of these people and saying that they failed this major test. And you can't understand the reason for these layoffs unless you understand that dissatisfaction with the way that these agencies handled COVID. Rightly or wrongly, the American voters, a lot of them are very angry at these agencies.
But Jake, many also warn that these layoffs will actually reduce accessibility and affordability to healthcare. Also, as far as these job cuts are concerned, for example, at the National Personal Protective Technology Lab, won't these cuts give an edge to foreign competitors like China?
Well, they might. I mean, one of the things is that so much of what China does when it comes to their research, and this is something India knows about as well, is stolen from other countries. So if the United States cuts back on its research for certain technologies, China will as well, because so much of what they do is copying or taking what America innovates. So I'm not so sure China will get an edge. They will get an edge in how much money they'll spend on it, that's for sure. But more money doesn't always necessarily produce results, even in research.
Yes.
But again, that is something that we'll have to see. It's just too early to see this, which is why saying everything is going to be okay and also saying everything is going to be a disaster is really premature right now. We have to be very, very suspicious of anyone who says they know exactly what the results of these layoffs are going to be right now.
Right. Jake, as always, thank you so much for joining us with the latest. It is too early to say at this stage how exactly these layoffs will play out, but the efforts to push out senior leaders, many warn, who are overseeing the scientific research, the reviews of medicines, of tobacco products, they go further than the effort to streamline the department that agency officials had publicly described earlier.